Hello and welcome. Today we're diving into a fascinating, albeit visually striking, condition called black hairy tongue. It sounds alarming, but rest assured, it's usually harmless and temporary. Join us as we explore what causes it, how it develops, and what you can do about it. So, what exactly causes black hairy tongue? The primary culprit is an overgrowth of bacteria and yeast on the tongue. This overgrowth can be triggered by a variety of factors. Poor oral hygiene is a major contributor, allowing those microorganisms to thrive. Certain medications, particularly antibiotics, can disrupt the normal balance of bacteria in the mouth, leading to overgrowth of the less desirable ones. Excessive coffee or tea consumption, smoking, and even a diet consisting primarily of soft foods can also play a role. Rarely, it may be associated with radiation therapy to the head and neck. Let's delve into the pathophysiology. The surface of the tongue is covered in small, finger-like projections called papillae. Normally, these papillae are constantly being shed and replaced. However, in black hairy tongue, the dead skin cells on the papillae accumulate instead of shedding, leading to elongation. These elongated papillae then become stained by bacteria, yeast, food particles, tobacco, or other substances. The color can range from yellow or brown to, most dramatically, black. This change in color is due to the chromogenic bacteria, the bacteria that produce pigment. Black hairy tongue isn't considered a common condition, but its exact prevalence is difficult to determine as many cases go unreported. It affects individuals of all ages, but it's more frequently observed in adults. Risk factors such as smoking, poor oral hygiene, and certain medications can increase susceptibility. There isn't a significant difference in occurrence between males and females. The appearance of black hairy tongue is its most striking symptom. As the name suggests, the tongue appears dark, often black, and hairy or furry due to the elongated papillae. Other symptoms might include a metallic taste in the mouth, altered taste sensation, bad breath, a halitosis, a burning sensation on the tongue, or even a gagging sensation if the papillae become excessively long. Diagnosing black hairy tongue is usually straightforward and based on a visual examination of the tongue by a dentist or physician. The distinctive appearance is generally sufficient for diagnosis. Rarely, a microscopic examination of a tongue scraping might be performed to rule out other conditions or identify specific microorganisms. Generally, black hairy tongue isn't classified into different types. The variations usually involve the color of the tongue, which can range from white, yellow, brown, or black, depending on the staining substances and the dominant microorganisms involved. The good news is that black hairy tongue is usually easily treated. The first line of treatment involves improving oral hygiene. This means brushing the tongue thoroughly with a toothbrush or tongue scraper several times a day. Avoiding causative factors like smoking, excessive coffee or tea consumption, and certain medications if possible under medical supervision is also important. In some cases, antifungal or antibacterial mouthwashes may be prescribed by a dentist or doctor. In very rare instances, persistent or severely elongated papillae may require trimming. Preventing black hairy tongue mainly involves maintaining good oral hygiene. Regular brushing of the teeth and tongue, flossing, and using an antiseptic mouthwash can help prevent the overgrowth of bacteria and yeast. Avoiding smoking and limiting coffee and tea consumption can also be beneficial. If you're taking antibiotics or other medications that might disrupt the oral microbiome, discuss potential side effects and preventive measures with your doctor. The prognosis for black hairy tongue is excellent. In most cases, it's a self-limiting condition that resolves completely with improved oral hygiene and lifestyle modifications. While the appearance may be alarming, it rarely indicates a serious underlying health problem. Regarding recent research, studies are ongoing to better understand the specific microbial populations involved in black hairy tongue and to develop more targeted preventive and treatment strategies. Some studies explore the use of probiotics to restore a healthy balance of bacteria in the mouth, but more research is needed in this area.